Hi, welcome to Digital Dialogs, your compact conversations on the future of technology. My name is Rene from Reply, and today we are exploring a really cool topic which comes from the healthcare side of things. It's called transforming cancer diagnosis through digital pathology. What a mouthful, isn't it? But for this, we have a true expert today. I'm delighted to introduce you to Dr. Namin Ghaffari Laleh. Hi, Narmin. How are you today?
Hi, Renee. Thank you very much for the invitation. I'm doing very well, thank you, and happy to be here.
Awesome. Well, we are glad to have you. And then to unpack also this really strong title, digital pathology. But first of all, could you start, please, by introducing yourself and share a bit about your background and your research work and what you're doing?
Sure. So I am originally from Iran, and there I studied biomedical engineering, and I had a little bit of experience of doing working with C Sharp, a programming language for mainly for software somehow engineering. Then after my bachelor's, I decided to move to Germany to study my master's, and I got accepted in a program called Medical Photonics, which the focus was mainly to study different medical imaging techniques and how to process them. So my first hands-on interaction with AI actually goes back to exactly to this time, kind of, where I had a student job at Carl Zeiss Meditech AG,
Hmm.
and my task was kind of to evaluate some segmentation methods for OCT B scans of human eye. Then while doing that, I asked my supervisor why they don't use AI for this, and this question somehow resulted in a master thesis. So we defined the project as a master thesis for me. And although it took kind of 1 year for me, but it was an amazing time, I would say, because I developed the annotation tool. I went through all the annotations of the image. I developed the whole processing, the whole model, the whole training from scratch. I evaluated the results, presented them regularly somehow in different meetings. So totally amazing experience for me. And at the end of this approach, somehow it resulted in a patent with very good results. But it also convinced me that AI has a very big potential in healthcare. So that's where I started my PhD in Jakob Kata's research group
Hmm.
in 2020, actually, where the focus was to predict molecular alterations, as you already mentioned in the introduction, to predict molecular alterations directly from diagnostic whole slide images. And I defended my thesis March 2024, and since then I am a postdoc researcher funded by a GSK pharma company, and I continue investigating AI's power to defeat cancer.
Thank you. What a journey and really amazing accomplishments you did. And especially when you said, coming from like kind of a computer science background and then, tapping into this new field, but then also saying, hey, well, why don't we use AI, right? You're asking the right questions and then actually working on this yourself from scratch, training, labeling, annotating. That's really, really impressive.
Mhm.
Well, I'm not. That's why I'm not surprised you got a very good degree then. Anyhow, let's dive in our questions. Your research, as you said, focuses on using AI, and I also read it's around the topic of histopathology images to predict
Mhm.
clinical outcomes. So, first of all, please explain what is histopathology images, and then if you can walk us through how these AI systems work in practice, right? Like how does such a neural network, such an well, in the end, algorithm, right? Look at the slide and then predict things like genetic mutations or patient survival rates and so on that even some experienced, human pathologists might miss.
Mhm. So let me explain first the part about the histopathology. So histopathology is kind of science of studying the tissue.
Mhm.
What I mean with that is that when a patient has a suspicious lesion, for example, in the body, then what doctors do is they cut that lesion somehow out, Then they slice it into very thin layers. They color it, they process it, and then the pathologists are able to look at this slides under the microscope and do different diagnoses. First of all, for example, whether this lesion was malignant, whether there was a cancer somehow, cells within the tissue, or is it like benign, but also many other things that they somehow look at the tissue under the microscope and decide on the next steps that what are required. So our task is starting somehow where we call it computational pathology, or let's say digital pathology, where we actually scan this tissue slides and
Hmm.
then fit them into the computer. So instead of looking to the slides under the microscope, we just look at them in a computer on a screen.
Hmm.
And of course, now we have so images, and images are what we can feed into the AI and then train the model. So, what we do is actually we gather thousands, tens of thousands of images, and then we fit the somehow image to the neural network, to the deep learning, let's say, models. And we already know kind of the output of this image. So they are labeled data that
Hmm.
we have as an input. So we know whether a patient, for example, had a specific genetic mutations or alterations. We know whether the tumor somehow, how aggressive was the tumor, or whether the patient, for example, responded to a specific treatment or not. So this is like the known output, known label for our input data. And through this training, the AI learns to recognize very important patterns in the tissue for the specific output. And these patterns, for example, that can be the arrangement and, let's say, shape of the cells. It
Hmm.
can be the texture of the tissue. It can be tiny shifts in color distribution across different parts of the tissue. And the model learns how these features are important for a specific output. And just imagine providing a lot of examples to the model. At the end, somehow model builds this statistical understanding of what does that patterns mean. And then this is kind of something that probably even a highly experienced pathologist is not able to do, because we humans are limited somehow of processing thousands of ten thousands of somehow data at the same time. So when this model has been trained, then this is ready, and we can somehow test it with the unseen new data, and then there somehow, hopefully with a good accuracy, the model will be able to answer now the tests that we are running on a new data sets, to again somehow give the outputs whether this patient, for example, will benefit from specific treatments or not. Yeah, that's it. And also, it is very important to mention that um, that is not kind of where our somehow experiments finish, but we also really important, probably everyone calls the AI kind of black box. And of course, we also don't like to end up saying that, okay, we've trained the model and then that's the model somehow performance, but we usually want to also show that what made the model to do kind of predictions. So that's where we somehow visualize some heat maps, some explainabilities, to be able to explain the reason behind models decisions to pathologists and also to the patients, for sure.
Yeah. And that is fascinating, and especially your aspect that you said is like, we gotta have some transparency there. Like instead
Hmm.
of the black box, it's its own field of research, right? Explainable AI and getting transparency there. And I can totally see how in your field it's even more important, right? I mean, these are life changing decisions in the end.
Definitely.
And so human in the loop is a key element in all things when we talk about AI. And there's this I think from my perspective, there's a misconception and a little bit too much fear in the field that, AI is that strong, will replace humans. Nah,
Mm.
it's
Mm-mm.
going to augment us. And the human in the loop is a central element, especially healthcare. And when you talk about it, how important it is to actually classify the tissue correctly. I can share a personal story real quick. My father-in-law was diagnosed with brain tumor like 5 or 6 weeks ago, and he had surgery 3 weeks ago, and so they removed most of the brain tumor. And of
Mhm.
course, they then analyzed it in the lab. And just yesterday, he had a meeting with the doctor, and they were able to classify it. I forgot which kind of, but doesn't also matter too much. But the good news is, and it was really good news, and this is only enabled by this kind of field, is that his kind of tumor is not treatable with a medication, and it's not chemotherapy or anything else, but there's actually I think Swiss or US researchers found out that a particular off-label usage of a certain medication is actually targeting this particular type of brain tumor that is caused by some enzymes or whatever. Doesn't matter the details. But what I'm trying to say is your work is saving lives because you can classify these tumors correctly, and then doctors can subscribe the right medication, right? And this is a life changing, life saving work you're doing. So awesome.
Definitely. Definitely. That's where it kind of it goes to the precision medicine that now we try for every specific patient with their own somehow tumor properties to advise a specific treatment. And that's where somehow AI can help a lot because it is just speeding up the process a lot and also lowering the cost. So
Yeah.
I'm happy to hear that.
You also sorry, you have also published extensively on benchmarking different AI approaches and also ensuring that adversarial robustness is happening in these systems. And
Mhm.
so we already talked about the human in the loop factor and so on, but what are the key challenges in making AI reliable enough that real clinical decision making can be done? And how would you validate these predictions that they can be trusted in the patient care? I mean, it's all about trust, and we talked about transparency and so on. But how are you seeing that? How are you solving this?
Mhm. To be honest, I feel if someone asked me 6, 7 years ago about kind of yeah, developing AI for real clinical use cases, I would say, that's somehow very far away.
Yeah.
But the point is, it is there. And especially after large language models, I feel the AI is kind of in a level that we are really thinking of implementing and clinical routines, and somehow people are using it extensively. So, about the challenge, I would say the most important thing for me, and actually part of what I published and also dedicated my PhD thesis, was the generalizability of AI models. Because the point is, most of the times, these models that we are training, they are performing very good on a specific data set that we use for training from a specific country, from a specific hospital. But when, as I mentioned in the previous section,
Mhm.
that when you somehow test these models on a new unseen data set, then the performance usually drops a lot because they're really sensitive to staining techniques, to scanner somehow models,
Mhm.
and different somehow aspects. So the part of kind of benchmarking approach that we had to somehow check the generalizability of these models to understand how we can make the models to perform on different somehow patients from different areas. Because I had, for example, this experience that we have trained a model for MSI prediction in colorectal cancer in Germany, and then when I deployed that model on a patient cohort from Nigeria, it was not performing well at all. So that
Ah.
is the aspect that somehow
Mhm.
is very challenging and is very important to build generalizable model, which actually is possible if we have diverse data set, but
Mhm.
of course reaching that diverse data set is also a little bit difficult. But also the other aspect that you have mentioned is kind of adversarial attacks, and that's what I mean with that is that it is possible that you change a slight proportion of the pixels in an input image.
Oh yeah.
And although the model has been trained perfectly and had a very good performance, the tiny somehow pixels will change the output of the model completely.
Yeah.
So when we are talking about, let's say, implementing AI in clinical routine, we have to make sure that the models are robust against this kind of somehow change as well. And that's also a second part of my thesis, where I dedicated to investigate the models and approach
Hmm.
that they make the models more robust, more accurate, and not somehow sensitive to the this kind of attacks. So I would say it is somehow it is there are like a lot of also approaches now to mitigate somehow this problem. So I'm not that pessimistic about it. There are like many models that they are set now robust against attacks. They are really good in generalizability. Currently, we have a lot of foundation models that they have been trained on millions of images, and we see that they are very much generalizable somehow for patients all over the world. So we are going toward having, let's say, consistent, reproducible, and interpretable models in clinical somehow routine for patients.
Yeah, and you bring up a very important aspect of these adversarial attacks, right? I mean, we see it also with autonomous vehicles, self-driving cars, and so on.
Mhm.
I mean, there was a bunch of research. I think they just, there was a stop sign, and they just changed a little bit. Like
Yeah.
as a human, you would hardly see it, right?
Yeah.
And so it made it completely a different sign that was recognized. And
Mhm.
uh, well, I'm laughing, but it's not fun. But it shows you how much these systems are error prone with errors we couldn't even think about. And the point you make is also very important, right? That we need to make sure we have wide and diverse training data in these systems to not include any bias there. And
Definitely.
so, yeah, it's a very very important aspect. That definitely fascinating, right? It's not just about I would say the core recognition aspect and the core classification that works well, but it's also integrated into the whole kind of work also of a clinician, right? And that's my last question actually is, if we look forward into the future a little bit, and I'm interested in your perspective and vision, what you see. How is AI transforming the work of a pathologist? How is the workflow maybe already changing or has already changed, and the broader field that you also mentioned, the precision medicine, right? How is that changing? How is these workflows, the processes changing, and what are some of the most exciting developments you see that are moving, from that are moving this research into everyday clinical practice? Like for example, I saw recently, detecting melanomes like skin cancer and so on. It's a common thing. I mean, there's models around since many years actually now,
Yeah.
and I saw like here in the clinic here in Dresden, they bought a machine like that. It's fully commercialized, basically. Like
Mhm.
cameras, you go in, probably get naked or whatever, and then it scans you all over the place and detects all the melanomes. And I can tell you, also from like a personal perspective, like I would prefer that kind of a detection than a doctor. Sometimes there's just the whole kind of private and so on, right? So anyhow, I'm sorry, I'm getting a long-winded question here, but just to repeat it, and my question for you is like, how are you seeing is the workflow of clinicians transforming in precision medicine pathology, and what are some of the developments that are exciting where you see new research happening, but also how it's moving into practical clinical practice?
Okay. No, that's definitely very interesting aspect that you're mentioning. So in pathology, we are a little bit far away. So as you said, there are now also tools that they are commercialized for prostate cancer. For example, it is just only detecting also from again histopathology slides whether it is cancerous or not, but very basic somehow tasks. So, but how I see it, that AI will help pathologists in the near future, hopefully, is that I see it as I see AI as a second eye for a pathologist. With that, what I mean is that they can, first of all, kind of validate what they are thinking, but also I feel that AI can take over a lot of repetitive tasks that they are doing. So pathologists, when they are looking into the slides, sometimes they have to go through, I don't know, thousands of slides. They need to count the cells. They somehow need to rule out the cases that they are not, for example, cancerous. And this repetitive task is taking a lot of time, somehow a lot of their time. So I would say, I mean, I see AI where the AI is actually doing this repetitive task, which if you train it with a good amount of data, it will actually perform pretty good, pretty accurate, and then somehow free up the time of pathologists for more complex tasks, for where you really need the creativity somehow of humans, so that they make sense of difficult cases, they communicate with other clinicians, they guide the patient management. Because I mean, it is known for everyone that the pathology departments, I think everywhere, but especially in Germany, for example, they are really under pressure. There are more cases, the cases are getting complex, and there we don't have enough stuff somehow for that. And I feel AI can really help to reduce the workload and make sure that the patients get their results faster, because we are also talking about cancer, so every day counts and it is important to get the result somehow fast. um, but the other thing that I actually really excited, and I try to always somehow keep that also in mind, as I mentioned already, is the potential of AI in healthcare or in histopathology for cancer actually patients in
Mhm.
developing countries, because they're also where they don't have enough equipment, they don't have enough somehow trained pathologists, and everything is limited. Sending slides over, I don't know, borders is expensive, is slow. So there is also a high potential for AI somehow developments in healthcare for cancer patients, so that, as we mentioned, so that they can get this precision somehow medicine results, let's say, very quickly, as equal to everyone else in the world, and they can also get then the best somehow treatment for themselves. um but about the last question that you asked, like what excites me at the moment, I've and what I see would be very interesting to have. And there is a lot of research going on. As I mentioned, a little bit far away from, a little bit, but just far away from the reality, is the multimodal world, I would say, because the pathology is kind of cannot exist in isolation as one somehow single thing, but it makes sense when you mix it with genomic data, with radiology data, with clinical data, with patients' history. And currently, multimodal AI, where it is somehow getting different modalities of data, combining them all together, and not just saying this is cancer or not cancer, but analyzing everything together, and then somehow giving the best somehow outputs about the treatment, about somehow the future of how the treatment for the patient should goes on, and everything else. So I see the multimodality as coming, and I find it very interesting. And I think moving from single tasks algorithms to multimodal somehow decision support systems is what somehow will shape the future of AI and healthcare. And kind of I would like also to mention that I feel at some point, if we make AI invisible in the background, not just to hide it, but kind of it becomes a tool like any other tools that doctors are using, and we somehow maybe are make sure we are sure that they are accurate and reliable, and then somehow that's the moment where we truly will notice that it transformed somehow the field of healthcare.
That is a perfect closing. And I like I can only fully agree with what you said. I mean, these are very important aspects. And like I said, I'm incredibly thankful for people like you know, that put the effort into the research with AI where it really matters in the end. I mean, this is work by humans for humans, and in the middle we have an artificial intelligence that helps us. And also the aspect you mentioned about the kind of, you know, developing countries, like emerging countries,
Mhm.
like like you said, I mean, like this kind of, we're used to the high standard here in Europe, right, or other places where we have high standards in terms of treatments and so on. But of course, that's not available all over the place, and sometimes we forget about that. And so, working on this, where we have a scalable solution where we can make these diagnoses much faster and scale it to many, many more people. That's very much exciting. That's very much exciting.
Yeah.
So thank you so much, Normin, for sharing your insights, and again for the great work you're doing. That is again like true meaningful work. And so thanks for joining us today, and spending some time to share your expertise, how this is, you know, affecting the world of pathology, and how it's basically transforming healthcare and making it available for many more people. Exciting times, and thanks so much, Normin.
Thank you very much for having me here. It was a great pleasure, and I'm very happy that I could share a little bit about what I'm doing.
Awesome. Well, and thanks everyone for tuning in to Digital Dialogues, your compact conversations on the future of tech. Don't forget to visit our blog, to follow us on social media, subscribe to our Reply podcast channels, so you never miss an episode. And of course, you can always go to reply.com and check out the previous and upcoming episodes. With that, I thank you so much for joining us. Take good care of yourself and your loved ones, and we see each other soon. Bye bye.